So it's going to take time. And it's going to take time for several reasons. One is there's going to be production challenges, so it'll take time to actually produce the vaccine. It'll take time to actually distribute and supply the vaccines to different locations. And ultimately, it will take some time to get different proportions of the population vaccinated. So this is all going to take time. So all during that time, and before that, you need to continue all these other interventions, and then potentially for a while after. So we have to make it very clear that the vaccination is part of the response to the pandemic. It is a very important, absolutely there's not a replacement for a vaccine.
So first you immunize and then you see how well the vaccine is performing. So if it performs very well and we get a large population, and then we find with our community surveillance that the level of circulating virus in the community has dropped and dropped significantly such that it isn't in free circulation, you can start to relax your infection control measures, your distancing, you're being careful of crowded places, you wear your mask, you wear it properly for some time to come, because it is a good preventative measure until we are absolutely sure that the virus is not out there in circulation.
When you get the flu vaccine, you may feel some fatigue, you may feel slightly warm or tired or something of that sort. So the question is with this vaccine, whether you'll get some of the symptoms that are similar to COVID-19, but of course a lot more mild. That's something that we'll have to see, and it really depends on what the data looks like, and it also can be highly dependent on the person. So you can give the same vaccine to 10 different people, and you can get 10 different reactions. Now, I want to make clear that there's a difference between sort of an initial mild reaction and adverse reaction. So, of course, one of the things that everyone wants to be careful about is making sure that there aren't an unusual number of adverse reactions. Nothing is 100% clear of adverse reactions. There's always going to be some people that might get some bad reactions to anything, regardless of what you give to them. But the key is to make sure that that's not unusually high, and that those reactions can be dealt with very quickly and identified and dealt with very quickly.
When we start immunizing over here, we are going to have a surveillance system of all the patients. They're not patients, people. So all the people who have been immunized, we will make a note of them and then follow up a large representative sample to see if they are developing any unusual, unexpected, severe signs, symptoms that we had not thought of or expected. So one more thing I just wanted to add is we don't know if, for example, these vaccines may give you a mild infection but protect you from severe illness. So if it gives you a mild infection but protects you from severe illness and death, then you can also be infectious but immune. And under those circumstances, we need to be aware of it and continue to undertake good infection control measures until a large number of people, over 70%, have been immunized, and the circulating level of virus, therefore, in the country is at a minimum low level.
We have to keep in mind that this is not a sprint, it's a marathon. So being the first country or the first population to receive the vaccine is not really the goal. The goal ultimately is success of the vaccination program, and not just within a particular country, but across the world. So the question is whether we really need to have patience in terms of making sure that everything is in order, because we're in a situation where, if there's a misstep, then that could potentially set back the vaccination program months or potentially longer than that. So, a lot of people in the public health and the scientific community are urging caution. And so the question is, can we all make sure that we're taking the steps deliberately and carefully and not bowing to political pressure to make sure vaccines get out as quickly as possible? That really shouldn't happen.